But as we go forward, by 2001, it was 46%, by 2007, it was 63%, by 2010, it was a little bit more than 63%, but we were up to 1.5 million people filing for bankruptcy, which means over 1 million people were filing for bankruptcy because of medical economic difficulties. A big increase over the preceding 30 years. Now, not only were they filing for bankruptcy, you think, well, they should have bought insurance. Well, that's the problem. They did buy insurance the majority of the time. People that are in the lowest economic echelons, they don't file for bankruptcy. These are primarily middle-class people. And when you look at them, we find that 16 to 18% of our nation was uninsured at any one time, almost 47 million people. And 25% of our population had been without health insurance during the preceding 12 months. But the underinsured was the problem, because 75% of people who filed for bankruptcy had an income over $75,000 a year, had a job, had a home, and they had medical insurance. And yet they were still in the bankruptcy courts. So at that time, having medical insurance did not keep you out of bankruptcy. All it did was tell you that you were underinsured or had poor insurance. But it was not having enough insurance was not only bad for your pocketbook, it was really bad for your health. The American Institute of Medicine, a nonpartisan scientific group in 2010, presented a paper pointing it out that because of delayed entry into our system, we were seeing 45,000 deaths a year because of delayed entry because of no insurance or underinsurance. Folks, that's almost as many people as died in the Vietnamese War. It's more than the people die every year in automobile accidents. It's more people that die from gunshots in the United States every year, murder or homicide. It was a big number, 45,000 in 2010, because of lack of insurance. One person every 12 minutes was dying. So, but if we're paying twice as much as everybody else for health insurance, surely we've got a much better product. We've got the highest technology, we've got the most educated physicians, we've got the most compassionate and well-trained nursing staff. Surely we're going to do better than everybody else. This is another real shock. Okay, this is the same slide as before, as far as how much everybody's paying for insurance. Canada, you know about their social system. They're paying $4,600 a year, but my gosh, they're living to be maybe 1.76 years on average, and we're still under 80 years of age. They live 2 years longer than that poor health system they've got. The same can be said of France, Germany, and everybody knows the United Kingdom's problems. Why are we paying twice as much and not living as long, especially since the Canadians, they smoke twice as much as we do. You can take the same statistic to Asia and to Australia, and you're going to come up with the same numbers. This is the most shocking number of all to me, though. Yes. We have an infant mortality rate that rates us 60th in the world. Infant mortality is defined as deaths within the first year of life, from 0 to 1 year old. How in the world can our country be ranked 60th in the year? Well, currently we're 56th, but back then, when we started this, we were 50th. You can take a look at maternal mortality. You realize our maternal mortality during pregnancy and childbirth is twice what most of the European countries is? But you take morbidity and mortality elsewhere. Diabetics, we have twice as many amputations as everybody else. Asthmatics, twice as many hospitalizations. And the statistics go on and on and on in first world countries. Now, in case you think I got this from some left-wing liberal papers, I got it from the Central Intelligence Agency's website, which closely mirrors the World Health Organization's website. So we're paying a lot, and we're not quite getting what we think we're getting. So why did we need to change our healthcare system in 2010? Well, it's very easy. Our country could not afford it, individuals could not afford it, and we were not getting the best returns in the form of quality for what we were paying. It was recently said that we should not be concentrating on trying to decrease the taxes of the business corporations, because the gorilla in the room is healthcare. If they're having to pay 15, 20, 25% of their gross back into healthcare products, that's a lot more than they're paying in taxes. And it makes them much less competitive on the world stage. So from there, Congress came up with the concept of the Affordable Care Act, or Obamacare. Probably using the term Obamacare is a misnomer, because the first thing they did was take away one of its key elements, which was a Medicare, a primary care system for all. That was dropped right out. I like to look upon the Affordable Care Act as the good, the bad, and the ugly. Now, the good part of it was it did increase the number of people insured. All of a sudden, we had 23 million people dropping off of the uninsured road. But we still had 21 million people still uninsured. So we didn't quite get there all the way. That was the good. The bad, there was nothing in it that contained the cost of healthcare. And the ugly was, it did not look into the pharmaceutical situation one iota. That was a hands-off issue. So with the Affordable Care Act, it's relatively simple to remember. What is it? Just 3 parts to it. First, a personal and employer mandate that everyone is required to have health insurance, all across the board. The second part was that if you cannot afford health insurance, the government will subsidize your purchase of it. And there was a gradual subsidization through both tax cuts as well as actually paying the insurance companies from an income of $0 up to $75,000. So everybody could afford some of it. And the insurance companies had to offer a minimum amount of coverage. No more of this underinsurance. No more getting sick and realizing that you could not cover your medical bills. And that was a tough one for a lot of people to swallow. It had several things. One, pre-existing conditions, we eliminated that. 2, an annual payout, eliminated. 3, a lifetime payout, gone. Those were radical changes in the health insurance industry. But it had a lot of other things, like you keep your child on your insurance till the age of 26. And it had 10 areas of mandatory coverage. And those included, and you're gonna think, well, that's nonsensical, but some insurance companies didn't. It had to cover outpatient care. It had to cover hospital care. It had to cover emergency room care. It had to cover some rehabilitation. It had to cover psychiatric care. And one of the really tough ones, it had to cover maternity care. It had to cover pediatric care. These are things that were not in all insurance policies. By getting rid of pre-existing conditions and saying you cannot charge people more for pre-existing conditions, all of you that are sitting in the room with a double X chromosome, that was a pre-existing condition, and in the open market, you always had to pay more for insurance than those of us who were fortunate enough to have a Y chromosome. So we had the mandated coverage of 10 basic areas, and we mentioned that the pre-existing states were gone, and the children's could stay on your policy, and the prohibition of annual or lifetime limits. And now this is the ones that killed the insurance companies. This is the last one. It was mandated that insurance companies would have to pay 80 to 85% of their premiums back for healthcare. Now, previously, insurance companies were paying as little as 55 to 65% out. The rest was pocketed as profit, and doctors or hospitals would get a denial of services. Can you all imagine how much after that first year the insurance companies had to pay back their premium payers? Any guesstimates? What about $100+ million were paid back to the people on their insurance refunds? Now that did not sit very well with the insurance companies, as you might imagine. So, what is how did you do it? How did you make this Affordable Care Act work? Well, the main vehicle that was used was Medicare. States were encouraged to expand Medicare and funnel these subsidies through the Medicare expansion. And the majority of states did. Oklahoma did not.
Figures.
And we were going to expand, of course, the Medicaid for all individuals, but state and federal insurance exchanges were set up. And all these were marketplaces that had to offer these minimal insurances. And you could go online, look it up, pick out the one you like, choose and go there. And there were 3 levels that you could buy into. So that's how they were going to make it go. Who paid for all of this? We all know there's no free lunch in life. Somebody's going to have to pay if you're going to subsidize a significant percentage of the population. Well, let's start out with the individuals. If you could no longer buy subpar insurance, then your cost of insurance was going to go up, no question about it. But there was one particular segment of individuals, and that was those who were considered high-income individuals. If you were a family with an earned income of over $250,000 a year, you had to pay a 0.9% insurance surcharge. And if it was non-earned income, that is through your investments and whatnot, it was a 3.9% surcharge. So people who were making money from money, who made over $250,000 a year in non-earned income, were paying almost 4% that went back to pay for Medicare or insurance subsidization for everybody. Employers. No longer could employers offer substandard insurance, and before, employers even had the option of not offering insurance. But if you had 50 or more employees, you were mandated you had to offer them not only insurance, but good insurance. The government did have to kick in some money as well. The insurance companies, we mentioned the payback, they had to pay out what they were bringing in. Pharmaceuticals, there was a small one here. Medical equipment manufacturers, the markup on medical equipment is astronomical, but their tax was less than 5%. The last one, I keep scratching my head on. How much money did you think we were going to get from tax and tanning salons? But was it a success? Well, let's take a look at a couple of parameters we were talking about. This is American families and their medical bills. In 2011, the American families had an indebtedness of $56.5 million, and that had fallen to $43.8 million by 2016. So family indebtedness did definitely decrease. Bankruptcies. We were talking about avoid bankruptcies. 2010, over 1 million people took bankruptcy because of medical conditions. Well, this really, in looking at the report, this came out of Consumer Reports in May of this year. And it did not distinguish between medical and non-medical bankruptcy. But it shows that when the Affordable Care Act was brought in, there were 1.5 million people that year that went into bankruptcy. You go to 2016, and that number is cut in half. So yes, the Affordable Care Act had a significant role, and for most of the 700 and some thousand families, the Affordable Care Act kept them out of bankruptcy. So economically, it was definitely a limited success, but it was a real success. Partially limited success, I guess, because there was a limited control of medical costs. That is, there was nothing specifically in it that was going to control medical costs. And medical costs had been going up. There was a limited success in providing universal coverage to all